I love being a doctor at the Boiling River Clinic. It's been a great thrill for me now for more than 20 years to work here. I came to medicine in an odd way. I actually went to medical school not to take care of patients, but to be a scientist. I wanted to be an expert in pancreatic cancer and colon cancer. And indeed, I was a professor in the University of California School of Medicine in San Francisco for many years, doing basic science research, studying pancreatic cancer cells and colon cancer cells. But I was doing that at a time when research funding wasn't very strong. And when it was time to close up the lab and move into private practice, I was thrilled to be contacted by the Boiling River Clinic and have the opportunity to move to Jacksonville from San Francisco and have a really wonderful career and wonderful life here. It's really been fun. Patient care has been tremendously challenging, tremendously satisfying, and what I love about it is to bring together the science of medicine with the interaction with the patient, to be able to talk to the patient about a research study that's hot off the presses, or to talk about a collection of studies over many years and make it relevant to the patient so they can understand their disease process, understand why I'm thinking about them the way I am, and why I might pick a therapy or pick a nutritional approach or pick a diagnostic test. I just love bringing together the science and the humanity of medicine for my patients. I find an educated patient is going to get healthier sooner. They're going to take better care of themselves, understand the complexities of the therapy that I'm bringing to them. And so I love that aspect, talking about the disease from a pathophysiological standpoint, talking about the research in an area, and trying to get the patient excited about it to help them get better through that knowledge. Well, I have a wonderful family. I have a wonderful wife who's actually a practicing physician in Jacksonville. Barbara's a radiologist. We have 3 grown sons who are each excited in their lives. So we love going to see them. One lives in San Francisco, one's in Portland, one's in Connecticut. So we travel a lot with our children. I do a lot of community projects. I've been active with We Care Jacksonville, the free clinic system in Jacksonville, Florida this year, and the president. I also do a lot of environmental work. I founded an environmental unit of the Florida Medical Association where we help the Florida Medical Association identify important policy issues where the environment affects human health. So we talk to physicians and to the community about very important issues such as lead toxicity, toxins in the workplace, climate change, energy efficiency, air pollution, a variety of topics that affect human health. So I enjoy talking to the public, to physicians, and to legislators about the environment and its effect on human health. I do a lot of hiking. I'm outdoors a lot. I lead a hiking group in Nassau County. We built a park a few years ago in Nassau County, which I'm very proud of. It's been a great community for me and for our family. Well, the most common misconception in gastroenterology today is that colonoscopy is difficult. Colonoscopy is a very easy procedure. The bowel clean out the night before to clean out the bowels can be a nuisance, but the procedure itself is a breeze, and most people enjoy it very much. The nurses are wonderful to be with. The facility is fun to visit. The sedation is divine. So really, colonoscopy is not a big deal, and it saves lives. If everyone would just show up and get their stupid colonoscopy done every 10 years, we could eliminate 120,000 cancer deaths a year in the United States. It can make a big difference. So I encourage people to come and show up, get their colonoscopy done, and go on with their life. Everybody has some kind of gastrointestinal disorder. And what's so satisfying in gastroenterology to practice in this field is I can make anyone's life a little bit easier, whether it's indigestion or heartburn or uncertainties about what they should be eating or diarrhea or constipation, a variety of issues. I can really make their life better. And that's one of the reasons I enjoy gastroenterology. Almost anyone I meet, I can find something as we talk in the office to let them enjoy their life better and often live longer as well.